Hello and welcome back to another episode of Health Matters. I'm your health coach, Dr. Michael Chillemi, and this is going to be part two of Understanding Arthritis, the ultimate deep dive. What actually happens during osteoarthritis. So now we've developed a complete understanding of how a healthy joint functions. It's time to answer the question every patient eventually asks: what actually goes wrong? Most people believe arthritis starts when the cartilage simply wears away. While cartilage damage certainly occurs, that's actually not where the story begins. Osteoarthritis is a biological disease long before an X-ray finding. In fact, its microscopic changes are taking place inside the joint years before a patient ever feels pain or notices stiffness. Let's walk through exactly how osteoarthritis develops from the very beginning. The first stage usually begins with increased stress being placed upon the joint. That stress can come from many different sources. It might be the results of aging, can develop after an injury. Perhaps someone had a tear of a meniscus in the knee. Maybe they fracture a bone years earlier. Sometimes it's caused by excessive body weight. Every extra pound of body weight increases the force traveling through the knees several times over during walking. Poor posture can contribute. Weak muscles can contribute. Repetitive lifting can contribute. Years of poor spinal mechanics, sports injuries, occupational stresses, genetics. Regardless of the cause, the end result is the same. The joint begins to experiencing forces it was not designed to tolerate day after day. Initially, the body compensates beautifully, but eventually, the microscopic stresses begin to accumulate. Remember the chondrocytes we discussed in episode one? Those tiny maintenance cells living inside the cartilage. Their job is to constantly monitor the health of the cartilage surrounding them. When increased stresses develop, chondrocytes immediately recognize something's changed. Think of them like a smoke detector inside your home. When they sense trouble, they activate emergency response designated to repair the tissue. Initially, this is actually a good thing. The body's trying to heal itself. But if the abnormal stresses continue day after day and month after month and year after year, those repair systems begin to get completely overwhelmed. This is where modern science has dramatically changed our understanding of osteoarthritis. Years ago, physicians believed osteoarthritis was an inflammatory disease. Today, we know that's incorrect. Osteoarthritis isn't driven by the same intense inflammation seen in conditions like rheumatoid arthritis, but inflammation absolutely plays an important role. Once chondrocytes become stressed, they begin to release chemicals, messages called cytokines. Cytokines, you can think of them like text messaging system between cells. Some cytokines tell nearby cells, hey, start repairing that tissue. Others trigger inflammatory responses. Two of the most important inflammatory cytokines in osteoarthritis are called interleukin 1, often say abbreviated as 1L, I'm sorry, IL-1, and then tumor necrosis factor alpha, commonly called TNF alpha. These chemicals have powerful effects inside the joint. Initially, they're attempting to help, but over time, they continue to release, begins a more harmful situation than good. Once inflammatory cytokines become activated, they stimulate another group of cells called matrix. Okay, here we go. Matrix metal proteinase, or simply MMPs. I like that better, MMPs. These enzymes have one primary job: breaking down damaged tissue. And again, under normal circumstances, this is helpful. If damaged collagen exists, MMPs remove it. If damaged cartilage exists, MMPs help clear it away so healthy tissue can replace it. The problem occurs when MMP's activity becomes so excessive, so prevalent. Instead of removing only damaged tissue, they begin breaking down healthy cartilage as well. Oh no, that's a bad thing. Imagine hiring a demolition crew to remove one damaged roof from a house. Instead, they begin tearing down the whole entire house. That's essentially what's happening inside your arthritic joint. So, one one of the earliest changes occurring during osteoarthritis is that gradual loss of protoglycans. Remember? Protoglycans are the molecules responsible for attracting all that water into the cartilage. Without them, cartilage begins to dry out. The once soft, resilient cartilage becomes less flexible and loses its ability to absorb shock. Its smooth gliding surface gradually becomes rough. Long before cartilage disappears, it first loses its ability to function normally. Next, the collagen framework itself begins deteriorating. Healthy type 2 collagen provides the structure. Remember the steel foundation that supports and allows cartilage to withstand enormous forces. As inflammatory enzymes continue to attack the joint, this collagen network begins to develop microscopic cracks. Imagine a suspension bridge. If enough of the support cables begin ripping away, eventually the bridge weakens and falls. The same thing happens here. Without its collagen framework, cartilage loses strength, small defects become large. Eventually, visual cartilage damage develops. Healthy cartilage is remarkably smooth. We talked about that. Articular cartilage, remember? Okay. As osteoarthritis progresses, that smooth surface begins changing. Tiny cracks appear. The surface begins irregular. Small fragments of cartilage may even begin breaking loose inside the joint. Doctors sometimes describe this process as cartilage fibrillation. Instead of resembling smooth glass, the cartilage now resembles worn carpet. That's not good. With fibers beginning to separate, this dramatically increases friction during movement. So every step, every bend, every twist now places additional stresses on an already inflamed joint. As cartilage begins to deteriorate, tiny fragments of the cartilage break away into the joint space. The synovial membrane recognizes these fragments as damaged tissue. In response, it becomes inflamed. The inflammation is called synovitis. So, as inflamed synovial membranes produce additional inflammatory chemicals, sometimes it produces excessive joint fluid. This explains why many arthritic people, their joints become swollen. Patient often thinks swelling means they're injured themselves recently. In reality, the swelling may simply represent an ongoing inflammatory response inside the joint. Now, something fascinating begins to happen beneath the cartilage. Remember the subchondral bone, as we discussed earlier, episode 1? As cartilage becomes thinner, the underlying bone experiences greater mechanical stresses. The body responds the only way it knows how. It begins to build more bone. Initially, this seems logical. Stronger bone should produce more support and help the damaged joint. Unfortunately, the newly formed bone becomes denser, harder, less flexible. Doctors call this subchondral sclerosis. Instead of helping absorb shock, the bone now transfers even greater forces back into the already damaged cartilage. Cycle continues. One of the most recognizable features of osteoarthritis is the development of bone spurs. The medical term is osteophytes. Many patients hear the word bone spur and immediately think something sharp is growing inside the joint. That's not really what's happening. Bone spurs are actually the body's attempt to stabilize an unstable joint. When the body senses excessive movement, It responds by laying down additional bone around the joint margins. It starts to increase the surface area. It's trying to stabilize the area. Unfortunately, these new growths often create new problems. Bone spurs may reduce joint motion. They may irritate the surrounding ligaments. In the spine, they may narrow the openings where the nerves exit. So you can think of a bone spur. So, for example, in your neck, you might have we normally have a backward C curve in your neck. Let's say you have tech neck or you have straightening of your neck. Your biomechanics all changed. The weight shifted. Everything has changed. Once that happens over time, those bones try to restabilize the foundation, right? So if your curve is meant to be a backward C and now it's straight, your biomechanics are off. And the only way your body knows how to fix that is to restabilize. So it makes those bones, those rectangle bones, more those square bones more rectangle and wider. They start widening out the bones, and as they start widening out the bones, you start getting these little osteophytes that hang off the ends of the bones, and that's where we develop problems in the spine. And then osteophytes in your joints, they irritate the tissue around it. Okay, so here's a question: does osteoarthritis hurt? That really does bring us to one of the biggest questions patient asks. If there's no cartilage, if cartilage has no nerves, does arthritis hurt? The answer surprises many patients. The pain of osteoarthritis is not coming from the cartilage itself. It's coming from everything else that's surrounding it. Inflamed synovial tissue hurts. The joint capsule hurts. The periosteum surrounding the bone hurts. Ligaments hurt. Muscles begin to tighten to protect the joint. Bone marrow changes become painful. Even the nervous system itself becomes more sensitive over time. As pain continues month after month, it hurts. The spinal cord and brain begin amplifying signals. The phenomenon is known as central sensitization. Eventually, activities that once caused no pain or discomfort may now be very painful. That's one of the reasons two people with nearly identical x-rays may experience completely different levels of pain. Pain isn't determined only by structural damage. It's influenced by inflammation, muscle function, the nervous system, sleep, stress, overall health, and many other factors. So today we've followed osteoarthritis from the very beginning. We've started with a healthy joint. We've learned about cartilage, collagen, proteoglycan, synovial fluids, ligaments, muscles, and the remarkable structures that allow effortless movements. Then we watched as abnormal mechanical stresses triggered by micro injuries, chondrocytes attempt to repair. Inflammatory cytokines like IL-1 and TNF-alphas were released. Matrix metal proteinase MMPs began breaking down the cartilage. Protoglycans disappeared. Collagen weakened. The synovial membrane became inflamed. The subchondral bone remodeled itself. Bone spurs formed. And eventually, pain, stiffness, swelling, loss of motion developed. Understanding these biological changes is incredibly important because it completely changes how we think about osteoarthritis. It's simply not just a wear and tear. It's an active disease involving every major structure within the joint. And now that it is more evident than ever in the spine. In our next episode, we're going to build on everything we've learned today, and we're going to explore osteoarthritis of the spine, how it's different from degenerative disc disease, how it contributes to facet joint dysfunction, spinal stenosis, why bone spurs form around the vertebrae, and why understanding these differences is essential for choosing the right treatment. I'll explain why I believe identifying these structures early with appropriate x-rays is a valuable tool in helping patients understand the true source of pain. So as I say in all my videos, the information I've given you today is my opinion, my opinion alone. If you have a problem with osteoarthritis, please speak to your own physician. Let him do a full exam and understand what's going on with you. As I always say, we only get one of these. It's important to learn. Knowledge is power. Understanding your conditions, you can help yourself. You can do more. You can be better. Don't put your head in the sand. Understand what it is. You can help yourself. And maybe if you don't help yourself, maybe you can help your friend, your neighbor, your mother, your father, your brother, somebody in your family, right? They're worth it. So, as I always say, till next time, it's important to understand your health matters. I'm Dr. Chillemi. Until next time. So, this was episode 2. Episode 3 is coming. Episode 3 is going to be understanding osteoarthritis in the spine. Stay tuned. Till next time, be well, be safe.